Hello, my name is Karen Smith, and I'm here to share with you the advantages of participating with an accountable care organization, the Alidate ACO. I am a rural family physician, solo independent of 29 years service in the same community. I have enjoyed the practice of medicine. However, there have been challenges and some barriers making it a little bit more difficult. But as each day goes by, there's often a little surprise that helps me keep moving. Last week, a young mother brought in her 6-day-old little boy for me to do his first outpatient pediatric examination. And in the middle of the exam, of course, he started whizzing, giving me a nice christening. And Mom looked over and said, "Dr. Smith, I really appreciate all that you do for our children. I trust your judgment. I trust your knowledge. And that's why I bring my little boy and little girl to see you." And she was just so thankful. And I thought about it later. That's what makes a difference, to hear those kind words coming from our patients. However, it's not always the case. So what are our patients looking for? They're looking for good quality care from a physician who they can trust. And they want that care delivered in a very efficient manner, and they want access. They want to be able to call us when they need us, to reach us through our portals. They want to be able to access our telehealth systems so that they know that we will be there to care for them. And what about the doctors? What are we looking for? Well, I can tell you there have been many surveys to say that administrative burden reduction is at the top of the list. Please don't send me another prior authorization form. But I'm also looking for the professionalism, the doctor. We have so many people who say, "Oh, I can provide those services," but they're not a doctor. And we're losing our professionalism as a physician. And then we would also like to be paid for the services that we provide. We spent a lot of time in training and we have the experience and the knowledge, yet because of our loss of professionalism, we're not being paid for the services that we truly are providing in our communities. I've been in my community for several years, and the community has come to appreciate my presence. Now, they definitely like it when I pay my taxes every September, but they also recognize that I'm there for them. When we had the opiate epidemic, which we still have, our practice opened up and we started providing medication-assisted treatment. When the coronavirus pandemic hit, we were there. We made sure that the community knew that we had taken control of how to continue to provide care and make sure people were not left without the services of a doctor. Well, as we've moved through the art of doctoring, we just aren't able to do it anymore. Our good friend, Moyes Yuwa, in his book, The Art of Doctoring, gives 14 cases. And those discussions, how do we maintain the trust that we have with our patients? And then I have another good colleague who speaks of the fantasy of the practice of medicine and how do we continue to have that. And my own motto, the power of touch, physical, spiritual, and emotional. How can I continue to do that? Well, I started to seek solutions, and the Alidate ACO provided me with the answer. Alidate came to our rescue when we were without personal protective equipment. And they asked, "Do you have enough?" And they shipped them out, the masks, the gowns, the sanitizers. When we needed to have a little additional funding, because we participate in a Medicaid, Medicare shared savings program, we were able to receive some of that benefit. By participating with an accountable care organization, we share with our colleagues. Alidate brought forth relationships that we didn't have before. They connected us with insurance carriers and helped us to achieve contracts that we didn't have before. They also connected us with our other vendor services, like insurance for myself and our patients and for me. And so they were able to do that. And they also connected us with our marketing folks. And we also work with the Black Doctors USA, who help bring attributes into our practice. Participating with the ACO is of a great benefit. It makes a difference, and I encourage you to consider it. I invite you, become part of our colleagues and participate with the Alidate ACO. You will absolutely see a return on your investment. You will see that you are not alone. You will see that you will have the trusting relationship with your patients. And by the way, you can get back the joy of the practice of medicine. Join us. It is a solution which I really hope that you don't pass. The Alidate ACO has made a difference in my practice. Let us show you how it can make a difference in your practice.